Dear friends, good evening to all. I am Dr. Arun, consultant gastroenterologist and hepatologist. Today I am here to discuss with you all regarding viral hepatitis. What do you mean by viral hepatitis? In case if you are going to land up with any damage or any inflammation, if it is going to set in your liver, there is a possibility for you to land up in a condition what is called as viral hepatitis. Once the patient is going to have viral hepatitis, there are various etiological triggers for that. It could be because of hepatitis A, it could be because of hepatitis B, C, D, and E. These are all the common etiological sources. And there are so many other etiological causes for your hepatitis. It could be because of your bacterial focus. There are so many other reasons are there. But my primary interest to discuss with you all regarding viral hepatitis. First, regarding viral hepatitis, why I would like to choose this picture because in case if you're going to land up with hepatitis A as well as E virus, it is predominantly transmitted through fecal-oral route. What do you mean by fecal-oral route? If you're going to take outside foods for longer duration of time, and if you're going to do a unhygienic food practice, a safe water sanitation, if it is not going to be there, outside foods, junk foods, fried foods, there is high risk for you to develop this viral hepatitis A as well as viral hepatitis E. So the fecal-oral route is a predominant mode of transmission. But what do you mean by hepatitis B as well as C? It is predominantly transmitted through your parental mode. What do you mean by parental mode? It could be because of your needle sharing, or it could be because of your drug abuse, or it could be because of your sexual contacts, or through mother to child. There are so many modalities for your blood products. There are so many modalities for this hepatitis B and C to harbor, to transmit. That's the main area for me to take on the discussion with you all right now. But why the hepatitis B as well as C is more dreadful than hepatitis A as well as E? Because these two viruses, B and C, there is high possibility for you to land up in a condition what is called as chronic liver disease. It may prolong for long duration of time. And the treatment modalities for this condition, as per gastroenterologist's opinion, the treatment advent has been happened terribly an advanced phase as of now. But what are the various symptoms, what are the various manifestations a patient can harbor once the patient is going to land up with this hepatitis? You may have, for example, in hepatitis A as well as in hepatitis E, the common presentation, usually it will happen in school-going children. If you're going to take outside food, what you're going to exhibit, there is high possibility for you to develop a condition what is called as jaundice. If your eyes turns yellow, and there is high possibility if your urine color turns to be yellow, along with evidence of fever, joint pain, rashes, abdominal pain, vomit, and sometimes some patient may exhibit diarrhea, and there are so many other complications. Sometimes you may develop acute events in which you may need hospitalization, your liver enzymes may go high, and these are all the possible. Usually it will be self-limiting, there is no need to treat much. So consult the gastroenterologist, and basic treatment with first line of management itself will take care. And as the duration prolongs over a period of time, usually hepatitis A as well as E will recover well. But one thing I would like to point out here, in hepatitis E virus, even though it is predominantly through fecal-oral route of transmission, you need to be very, very cautious because in pregnant women, because once a patient is being pregnant, the risk of harboring these viruses will be more than 10 times higher. And once a patient is being pregnant, there might be high possibility for your fetal damage, and the baby may have other complications, and the mother may tend to be hospitalized in an intensive care setting, and there are high risk of mortality. And these things to be well executed in the initial phase itself to overcome the complications. Regarding hepatitis B as well as C, once a patient is going to go for chronicity, because without any symptoms, you may not exhibit any symptoms when you're going to do an incidental screening. That's why whenever you're going for a blood donation and other camps, you will be having a screening protocols for hepatitis B, C as well as HIV. These are all the common dreadful viruses in which if it is going to last for long duration of time, you may have multiple complications. Multiple complications like you may develop evidence of chronic liver disease. What do you mean by chronic liver disease? You may have multiple presentation. You may have jaundice. Some patient may not have jaundice, but doesn't mean the patient doesn't have evidence of hepatitis. You may have jaundice, and some patient may develop evidence of chronic liver disease pathology, like the findings may be fluid accumulation, which is nothing but ascites. You may develop fluid accumulation in your tummy, you may develop fluid accumulation in your limbs. That's what is called a spiral edema, and you may be emaciated. Your weight may go down, your tummy size is going to be enlarged. But this is what we used to call the richness will be below the level of your, in the level of your tummy, and the poverty will be in the level of your chest. So you are going to exhibit a weight loss, cachexia, severe marasmic changes. These are all the things may have happened, and sometimes some patient may have evidence of swelling in the cheeks, and the jaundice may go away. But if this kind of symptoms, if it is going to be there for long duration, you may develop a condition what is called as hepatic encephalopathy. What is hepatic encephalopathy? In which if your brain is going to get affected by your liver, so you cannot sleep. As the day progresses, your life is going to go down. So you need to screen yourself with a gastroenterologist as early as possible to overcome the presentation. So any joint pain, any fever, rashes, swelling, any initial phase of jaundice is very important for you to screen immediately to look for evidence of these kind of major viruses which is being there, and prompt treatment is very important. But once a patient is going for hepatitis B as well as C, you need to screen for long duration. Regular follow-up with the gastroenterologist is more important to look for evidence of cirrhosis. What do you mean by cirrhosis? It's nothing but a shrunken state of your liver. Once the liver function, if it is going to go down, as you all know, the liver does more than 1,000 to 1,500 functions as of now. Once the liver function is going to go down, you are going to land up with multiple complications, yet to food, various complications you may have. So in order to prevent that, you need to screen yourself. That's the most important thing I would like to highlight. And once a patient is going to develop this presentation, so serial follow-up is more important. And sometimes for hepatitis B, lifelong medications, and hepatitis C, 3 months to 6 months medications is there, but only the cost constraints and other things to be addressed in a prompt way. Even in our Indian scenario, as per the government programs, various programs has been established for free of cost of medication being supplied in various government centers in which to overcome the complications and other presentation. So reporting to the gastroenterologist is more important in prompt time. Once a patient is going to develop liver cirrhosis, in case of hepatitis B as well as C, there is high possibility for you to develop a cancer, what is called as hepatocellular carcinoma. It's nothing but a dreadful liver cancer. Once a patient is going to land up with evidence of this kind of dreadful complications, there is high possibility for the patient to have high rate of mortality. So you need to be very, very cautious to overcome the presentation. And how to prevent this? So mother to child transmission of your hepatitis B virus, you can screen very early in the initial phase itself of a pregnant woman. Apart from that, hepatitis A as well as hepatitis B vaccination is well available in the market. You can well use that. And hepatitis A vaccination, either a 1-dose protocol or 2-dose protocols are there. And hepatitis B, right from the pediatric age group, 3-dose regimen is there. So hepatitis A vaccine, the cost and other things we can easily address into that. But why I would like to point out, hepatitis A as well as B, there are vaccinations are there which is well available. Apart from the C, D and E, there are no vaccination. E is well controlled on his own with regular follow-up. B as well as C, serial monitoring to overcome the presentation. Always, once the patient is going for evidence of chronic liver disease, the most important thing, you need to be on regular adherence to the medications, regular follow-up to prevent the complications. The most important thing, how to overcome this presentation. So you need to control your weight. Avoid unhygienic foods. Make your water practice in a sanitation practice in a safe way. Apart from that, unhygienic food habits, never, you are not supposed to take that. And screen yourself. And most important thing, avoid sharing needles, avoid sharing razors. Don't go for razors, shaving, and for example your tonsure and other purpose. Never go outside. Make sure that you're going to use safe razor practice, and never share any needle. And for example, the tubings, for example the dialysis, if the patients have a kidney disease, if you're going to share the tubings and other things, there is high possibility for you to develop hepatitis C as well as hepatitis B virus. So all these things, and mother to child, if the mother is harboring a virus, so you need to be cautious. The baby may also be affected. In order to prevent that, the screening is very important, controlling the complications, take care of your liver, and have adequate, good, nutritious diet. Control your obesity. If you're overweight, control your obesity, and control your thyroid, because thyroid status sometimes when worsen your levels. And apart from that, control your diabetes, diabetic capital. You need to control your diabetes, because metabolic syndrome, if it is going to be supervened, there is high possibility for you to have worsening of your chronic liver disease. And control your hypertension. Screen yourself early with the gastroenterologist to overcome the presentation of this hepatitis related complications in a successful way, and make sure our India should be a proud nation in overcoming this hepatitis in a successful way. Thanking you all for patient listening.